In this webinar, we would learn the essentials and initiation of bubble CPAP in a newborn. Delivery of CPAP to a newborn includes delivery of continuous positive airway pressure to the airway and lungs, delivery of air and oxygen mixture at the preset fractional oxygen concentration, and delivery of air oxygen mixture at body temperature and at a relative humidity of 100% to the newborn nurse. The three most common indications for CPAP in a preterm newborn are respiratory distress with a Silverman-Anderson score of more than or equal to 3, post extubation from a mechanical ventilation, and recurrent apneas or apnea requiring positive pressure ventilation. However, presence of spontaneous breathing efforts is a prime requirement for CPAP delivery. CPAP is also indicated for airway malformations such as tracheomalacia and for phrenic nerve palsy. The indications of CPAP in a term newborn are respiratory distress with a Silverman-Anderson score more than or equal to 5 and also for post extubation from mechanical ventilation. Poor respiratory efforts, malformations such as congenital diaphragmatic hernia, tracheoesophageal fistula, cleft palate are the contraindications for CPAP. CPAP is also not the choice of respiratory support if the newborn with respiratory distress also has cardiovascular instability. The steps of CPAP application to a newborn would include connecting the newborn to a pulse oximeter, fixing the cap of right size, fixing appropriate type and size of nasal interface, checking the CPAP circuit for air leaks, and then connecting the CPAP circuit to the nasal interface. These two figures depict two newborns supported on CPAP, one supported on CPAP with Hudson prongs and the other supported on CPAP with Fisher and Paykel nasal prongs. Immediately after connecting the newborn to a CPAP machine, one should insert an orogastric tube and fix it to the side wall of the warmer or incubator. In this figure, one can notice the tip of the orogastric tube placed at a level more than the stomach level of the newborn and the tip of the tube is open to atmosphere. If a newborn is supported on CPAP for respiratory distress, remember the rule of 5. At initiation, one may support such a newborn with a CPAP pressure of 5 centimeters, an FiO2 of 50% and a flow of 5 liters per minute. So, to summarize, CPAP is initiated in a preterm infant with respiratory distress and having a Silverman-Anderson score more than 3, whereas CPAP is initiated in a term infant with respiratory distress and having a Silverman-Anderson score more than 5. Remember the rule of 5 when initiating CPAP for respiratory distress in any infant. Thank you.